In this final regular COVID-19 briefing from the province, Dr. Brent Keystone, Chief Provincial Public Health Officer, talks about the toll the pandemic has taken on the province. It's not just the number of cases, the number of deaths, or the healthcare stresses. It's about how Manitobans have coped these past 2 years through struggling businesses, mental health pressures, and strained relationships. One of the fundamentals going forward will be striving to treat one another with respect, kindness, and compassion for people's decisions. 2 items announced this week will have a significant effect on our area. The COVID-19 testing site at the Keystone Center in Brandon will be closed as of the end of day, March 20th. Still open for limited daytime hours are the Brandon drive-through testing site and the Dauphin testing site. Testing will also still be done in clinical settings for symptomatic individuals eligible for treatment options and in other clinical situations. As well, the vaccination super site at the Keystone Center is now closed. Vaccinations remain available at clinics and pharmacies throughout the region. We now join Dr. Keystone for his briefing.
It's been more than 2 years since Manitoba has confirmed its first case of COVID-19 on March 12, 2020. It's difficult to put into words how challenging these last 2 years have been for Manitobans. We've seen many Manitobans who have lost their lives to COVID-19. Tragically, more than 1,700 Manitobans have died from COVID-19. For those left behind, for those who have lost other loved ones for other causes, they've been forced to mourn those losses in dramatically different ways without much of that community of care we often rely on. We've seen others suffer severe outcomes with quite lengthy recoveries. Special occasions, births, birthdays, graduations have gone uncelebrated. Seen the devastation caused to many Manitoba businesses and to places that we all enjoyed frequently. Due to the pandemic and the necessary restrictions, many Manitobans have had their mental health adversely affected. These last 2 years made it necessary for Manitobans to give up much of what they enjoyed. But through it all, Manitobans stepped up. They limited the spread of the virus. They limited the impact on our healthcare system to keep all of us safe. We did that by following public health advice, by abiding to public health restrictions, and most importantly, by getting vaccinated. And that vaccine campaign was of unprecedented size and scope. We're certainly at a different place in this pandemic, a time of transition. And now Manitoba, we all know that our public health orders ended earlier this week on March 15th. Province is now under green in the PRS. We've been able to change our approach from strict public health measures to public health recommendations. Like guidance is now available online to help support people in their own decision-making, to assess their level of risk when it comes to things like mask wearing, physical distancing, and how many people they're comfortable with gathering along with. I've talked a bit about the many harms and losses that were caused by the virus and the pandemic and the public health restrictions. Some of those harms include the divides that were created by the virus and by the restrictions. And those divides are persisting now. We know that COVID-19 very likely will be part of our lives for years to come. So we can't wait for COVID-19 to be gone before we start our journey of healing. The first step on that journey could be as simple as just acknowledging that all Manitobans have undergone a very difficult time over these last 2 years. We may not have agreed on the best approach on public health measures and different measures during the pandemic. We may not all agree on the timing of the loosening of the restrictions, but I'm sure we can all agree that all Manitobans have been faced with tremendous challenges and difficulties during these last 2 years. That we see businesses now, some choosing to keep the proof of vaccine, others leaving that in the past. Some people will continue to wear masks, others will give that up. For many, these choices aren't easy, but we sure can make it easier on each other if we show some respect, kindness, compassion for other people's decision as we navigate this transition period. Now more than ever is that time for kindness and compassion. Throughout this pandemic, Manitobans have been served by a dedicated team of public health experts with very diverse backgrounds. As the Chief Provincial Public Health Officer, it's my job to listen to their expertise, to share it with Manitobans, and that's been truly an honor for me over these last 2 years. None of this work would have been possible without that tremendous team. Their work has kept Manitobans informed, guided many of our decisions, and found many solutions to very difficult situations. The virus certainly isn't done with us, and neither is the help that the public health team is going to continue to provide for us. We're going to continue to actively monitor COVID-19 nationally, in Manitoba, around the world, and certainly focus on those key indicators that we've all become aware of. This is the last formal COVID-19 briefing, but I can assure Manitobans that our work on this virus is not stopping at this point. I want to provide another update on what this transmission means to some of the other spaces connected with the COVID response. So we have very strong immunization rates, and while we need to continue to support access to that vaccine, we're at a point where that infrastructure of our provincial and regional sites are no longer necessary. The vaccine sites in Brandon and Morden are now closed to the public, and other locations will wind down in the weeks ahead. The RBC location in Winnipeg will continue to be open and take appointments and walk-ins for a while longer. And while these locations are changing, we will continue to work with regional health authorities and our communities, clinics, pharmacists, to continue to ensure that vaccine is available and accessible. Rapid tests are available and widely distributed by community partners and retail locations. The number of people attending provincial testing sites for PCR testing has declined significantly recently. And as a result, we're consolidating provincial testing sites, and 18 sites are going to be closing on March 20. Some sites will be maintained for people eligible for PCR testing, like pre-op patients and people who are at higher risk and may be eligible for COVID treatments. Rapid tests will continue to be available at provincial sites going forward. To wrap up, I would like to express my gratitude to Manitobans for all that you have done over these last 2 years to slow the spread and protect the healthcare system and people who work in it. Thank you for following those public health orders, even though it was quite difficult. But it certainly was the right thing to do at the time. All Manitobans stepped up to chip in. Thank you for choosing to be vaccinated when it was your turn. And thank you for your compassion and kindness as we move forward into this next phase of COVID recovery. Thank you, Manitobans. We can now open to questions.
Thank you, Dr. Roussin. We start today with the Brandon Sun. A reminder to reporters, we'll go with one question, one follow-up, and perhaps more questions at the end once we get through everybody. Brandon, Karen, go ahead.
Yes, well, thank you for meeting with us today. And just for in terms of the sites, it's been said in the past that there is infrastructure in place just in case we ever have to ramp up or down ever again. Is that in place for things such as, you know, testing, vaccines, and of course, in case we need them again, mandates and restrictions again?
Right. Yeah. So for all the response to the pandemic, things like testing, vaccines, all of the plans that include ramping down all have embedded in them that the plan and the ability to ramp up should we need it. So certainly that's part of our response at this point.
Okay, thank you for that. Also, just related, in terms of reporting, just wondering, we've received some notes about, you know, outbreaks that have been happening here, especially one that's owned by Rivera here, Valley View. I have pretty good source that says that there was an outbreak and it's still going on, but every time I go on the dashboard, it's not listed. So if you could clarify exactly how the province is going to be reporting things like outbreaks on the dashboard going forward.
Yeah, and so we'll provide some more specifics on that. Certainly, we're decreasing the frequency of our reporting. We're going to move away from reporting widely each and every outbreak related to COVID-19. So there'll be more details, and it'll still evolve over time.
Up next from the Winnipeg Sun, Ryan.
Hey, Dr. Roussin. With the province sitting in green right now, as you said, just curious as to why this press conference is being held virtually.
Well, it's just the logistics of issues. So for most of this pandemic, we've been in 68, and so I think just with the availability of remote conferences like this just adds to the easier logistics.
Okay, thanks. And as far as when COVID will be declared endemic, when do you anticipate that will happen in Manitoba or Canada?
Yeah, and so this is something that we've been discussing for quite some time. What is the true definition of something being endemic? And so we'll see on how that evolves over time. I think what's really important is that we're going to still have a lot of surveillance for this virus. We are adjusting and lifting our public health measures as appropriate. And whether we label something as endemic or not, that's going to be of less importance.
From CBC Radio Canada, Chantalia. Chantalia, go ahead.
My mic couldn't open. Okay, so first question. When do you estimate that the relief that we are having right now, this transition, will be done, and then we'll go back to being like we will see overwhelming pressure in our healthcare system? Do you think that will happen, and when?
Yeah, well, I mean, it's tough to predict the future. Certainly, our plans relate to what we're seeing right now with the virus and responding accordingly. We do have the ability to ramp up our response as necessary. We know that the healthcare system, for many reasons, has been under strain, and they have plans in place to address those. But it's very difficult to predict on what the future will hold for us.
Thank you. And my second question will be: this is the last briefing regarding COVID, unless it's necessary. What will determine it is necessary to have another briefing?
Well, I mean, the main purpose of these are to inform Manitobans of significant changes related to the pressures of that virus. And so should we see any changes in the epidemiology or changes to our approach that we feel Manitobans need to be informed of, then we'll do so. But this isn't necessarily the only method of doing that, but for significant issues, then this has been the form that we've liked to inform Manitobans.
From CBC Manitoba, Alana.
Hi, Dr. Rusin. I'm wondering if you could tell me, how does Manitoba's limited PCR testing affect the province's ability to identify future variants of concern early should they emerge? And by that, I mean, if there is a variant of concern that's identified, will the province ramp up testing then, or will the province wait until a case is detected here? And could that mean that a variant could be spreading here for a while before it's detected?
So it's again difficult to look at potential future scenarios. Right now, we continue to do PCR testing. We sequence a certain proportion of that. There is surveillance at for travelers returning, and then there's surveillance internationally. So it's extremely unlikely that a variant would first arise in Manitoba. So as we see surveillance detecting variants of concerns in other parts of the world, then we will have to adjust our approach to that to ensure we're doing all the steps appropriate to detect that.
And the mask mandate was dropped for a short time last summer. What would lead to the province putting a mask mandate in place again? So when it comes to hospitalization and ICU, like what numbers would you be looking at? And would other factors like school absenteeism be part of that decision as well?
So we're going to look at a number of those indicators. You mentioned them, and what's going on around us throughout the nation and the world. But again, it comes down to severe outcomes, and if we're seeing a increase in those, then we still have to look at what measures we want to use. Certainly, masking tends to be the least restrictive measure, so that could potentially be one that comes back should we see increasing transmission. But again, it's right now the mask mandate has been lifted, but certainly there's recommendations that you can find online for people to be wearing masks. I'll certainly be wearing a mask in crowded indoor public places, and that's an option available to Manitoba that's going forward.
Moving now to the Canadian Press and Steve.
Hi, Dr. Rusin. We're seeing now in Europe, in many European countries, a sharp increase, week over week, a double-digit percentage increase in the number of cases, and its preliminary data suggests it might be likely tied to the BA2 variant. Does that give you cause for concern that it might happen here as we're lifting restrictions later than many European countries did?
So we're certainly watching, the epidemiology around the world quite closely, and those numbers you mentioned certainly we're watching very close. We're going to see how that translates into severe outcomes, which is really the ultimate concern that we want to watch. And then again, how that plays into whether there is a ongoing seasonality to this as we start hitting our spring and nicer weather. So those are all things that certainly are concerning, and we're watching quite closely.
And we're lifting restrictions as the healthcare system in terms of capacity and surgical backlogs is still very much in an early recovery mode. Do you have modeling that might give us some idea as to how high hospitalization numbers may go in this period where we're still trying to catch up to the surgical backlog and get our ICU numbers down to a sustainable level?
Well, currently our modeling continues to suggest a downward trend in hospitalizations and ICU admissions. So it's again something that we watch very closely, but right now we're continuing to see a downward trend.
And up next from CTV, Michelle.
Hi, Dr. Rusin. I wanted to ask about the long COVID working group that's being established and what sort of resources will be made available for patients, especially those who, need some sort of proof that they have long COVID symptoms that may be preventing them from, going back to work.
So things like clinical diagnosis and treatment, such as for things like long COVID, those are best addressed at shared health. Those won't be that's not being set up through public health. So it's probably best to address that through shared health.
Okay, so public health wouldn't be doing anything on the long COVID front then? Like, what can people expect from public health then on who might have long COVID?
Yeah, well, so public health doesn't diagnose or treat disease for the most part. That's the healthcare system that does. Manitoba Health or public health will, surveil diseases, have population level approaches to those, which we've done for the cause of long COVID, right? COVID-19. But as of right now, there isn't a jurisdiction and there that has long COVID as a reportable illness. It'd be very difficult, as this is very tough to come up with a clear case definition of. So the diagnosis, treatment of clinical conditions is done through the healthcare system.
And from the Free Press, we go to Katie.
Good afternoon, Dr. Rusin. Do you have an estimate on the percentage of Manitobans who are estimated to have immunity right now, whether that's through vaccination or having contracted COVID-19?
So it's a bit challenging. We do have some seroprevalence studies that will have suggestion how many people have been infected with the virus. We do need to look at how many people were both infected with the virus, how many people were vaccinated, what that overlap is. So it's really tough to have that estimation. It's certainly a high proportion of Manitobans that have some level of immunity because we have such significant vaccine rates right now. Add to that the amount of Manitobans that have been infected with any of the variants, but especially Omicron. So we have very high levels of immunity to the virus in one shape or form.
You mentioned you'll continue wearing a mask in crowded indoor places. Are you personally worried about the risk of getting COVID now that the restrictions have been lifted?
Well, the measures that we always put in place, these are always put in as at a level that in public health we feel is appropriate for Manitobans as a whole. There's always going to be individuals who are at increased risk for severe outcomes who have to take extra cautions. So at this point and at any point in the pandemic, I've always felt comfortable following the public health restrictions that were in place.
Up next is Global and Rosanna.
Hi, Dr. Rusin. We've seen the availability of testing shrink in the last while, along with other data. Can you guarantee we'll have access to COVID hospitalizations going forward?
I'm not sure I understand the question, like the ability to report on how many people are admitted to hospital due to COVID-19?
Yeah, that's right. Will you be reporting those numbers going forward?
Well, certainly that's the plan, and so those are the the most important indicators. Are a lagging indicator, but at the point where we are right now in the pandemic, they're the most important indicator. And so certainly people who are admitted to hospital, who are ill enough to be admitted, will be undergoing PCR tests. So we'll still always have fairly good reporting numbers on those who are ill enough to be in hospital, much similar to influenza, right? We dramatically underreport how many people are infected with influenza because not many people are tested. However, we have relatively good numbers for how many people with influenza require ICU admission or admission to hospital, because those are the people who will very likely be tested.
Thank you. And with regards to the 18 PCR testing sites, do you have any more information of which ones those are?
I think we'll probably be sharing that more broadly with the specifics. I don't have those specifics right in front of me.
Okay, that concludes our list for today. We do have time for a few more questions. We will now open it up to a scrum.
Dr. Rusin, the head of Pfizer has talked about perhaps the need for a fourth shot. And I know it's very preliminary. This has to go before regulators and national recommendation groups, that sort of thing. But given that, will there be a need to ramp up again if this does go through? Will there be a need to ramp up vaccination sites that are now being ramped down?
So we do, for all of our COVID response, we do have plans, if necessary, to be able to ramp those up. For vaccination, we do have many community partners now in the distributive model, clinics, pharmacies, where a lot of capacity can be diverted to. But if necessary, we will always do what we need to protect the health of Manitobans.
And do you expect people, I'm thinking of business owners who may want their customers to wear masks and may want to enforce that rule, but may feel pressure not to do so because they're in essence trying to enforce a recommendation rather than a public health order. So do you see that negatively affecting mask usage?
Well, I think that everyone's going to have to make that decision at their level. Certainly, there's a lot of policies that various businesses have that don't stem from a public health order, yet they enforce it. And so it's really going to have to be that personal choice. Again, we talk about this, the many divides that have been created by the pandemic and the restrictions. So I really want to reiterate that, especially during this transition phase, let's all just be, respectful, kind, compassionate to others. And so if there's businesses that feel what's best for their customers and their employees are to wear masks, let's respect that. And let's try to be compassionate to each other during what's already been a difficult 2 years. And now we're dealing with a difficult transition phase.
Okay. And for myself, just getting back to some of the reporting, especially things of outbreaks, just considering with Revera, they're a private firm, plus they've had outbreaks before, but in the times I've tried to get information from them, they've just told me to go to Shared Health, but Shared Health tells me they're private, so they really don't keep the numbers. So I'm just wondering, going forward, how are we going to be able to report accurately on whenever there's a major outbreak at a facility, private or semi-private or public?
And so the approach we've always taken for outbreaks, really the most important thing is that we ensure we communicate to those that are affected, that are in need of information. If there's exposures, if there's outbreaks that the public will need to know about in order to protect themselves, and certainly we focus on that. I don't know the details of the situation you're discussing, but for the most part, that's where we deal with outbreaks, respond to those that are at risk of those outbreaks, and if it's the public in general who's at risk of it, then we would do more of a broad communication.
Dr. Rusin, with PCR tests sites closing and access to those tests further restricted, is the province considering any mechanism by which the public can report rapid test results?
So at this point, no, we don't have any immediate plans for that. We are still going to be doing significant PCR testing in hospital, for people who are ill, for pre-op testing. We know for returning travelers there will be random testing, which will act as further surveillance. What we really need with the testing now is where it's clinically indicated. So we're at a point in the pandemic where we don't need widespread testing for surveillance purposes. We should be limiting our testing to where it's clinically relevant. So people who would qualify for treatment, then they should be tested, whether that's rapid antigen or PCR, whatever is available, so that they could have timely access to treatment.
How
often should people be, rapid testing to kind of try and keep from spreading the virus in more high-risk situations? So somebody who's boosted might not have any symptoms, but if they're going to visit their grandparents who are seniors, should they take a rapid test, or should you only be taking a rapid test if you are symptomatic? They're widely available now to people to pick up. So how would you recommend they get used by the public?
And so I think this is going to be another thing that will evolve over time, and that it will deal with our own perception of risk. For the most part, we are suggesting people with symptoms stay home when they're sick. This is the most important aspect of this. People who are symptoms can certainly undergo a test, and if they test positive, then they should stay home when they're sick. If they test negative, you should still stay home when you're sick. People who may want to test when they don't have symptoms, if they're entering a high risk scenario, that may be something that they choose to do. But for sort of that widespread asymptomatic testing is not something that we recommend for the most part.
Any other questions? Got a minute or two. Last call for questions.
Yeah, okay. Dr. Roussin, as you look back on the last 2 years, you faced some personal heat for the decisions you made, and I know there were some uncomfortable moments in terms of being targeted over this. What's ahead for you? Do you plan to stay on as Chief Public Health Officer? Where do you see your energies going now?
Yeah, I think that there's still a lot of work for public health to be addressing moving forward. Much that we had to put somewhat on hold because of a response to COVID-19, and have a tremendous team here at Public Health. So I look forward to continuing to work with them.
All right, that's probably as good a place as any to leave it. Thank you very much for your time, Dr. Roussin, and thank you to our media. This concludes our briefing.
Thanks, everyone.